Hi, this is Dr. Mark Agresti with Susan Young, who has given me permission to film her while she gets her Spravato treatment. Where we are at this point, Susan, you had a treatment 5 minutes ago, and we're about to do her second treatment in each nostril, so she'll be getting her second dose of 28 milligrams. Susan, could you show us the, here's the Spravato. It's got 2 green dots, and she's going to press it in each nostril and get an inhalation in each nostril. So go ahead, Susan. Now I'm going to demonstrate how she's going to use it. She's going to close one nostril, put it in the other nostril, start breathing in, press it, keep breathing in, and keep her head at a 45-degree angle. She's now 5 minutes into this, and now she's going to repeat it on her other side. I'm just coaching her as I'm talking on this. It's me here. Hello, everyone. Dr. Mark Agresti. We're trying to film it, but I'm using my hand. But now we're going to go with the second. Keep breathing in. Did you get it?
Oh, yeah.
Susan is very good. The technique, we mastered it. This is the second time she's done it. Her first treatment was on Monday. It's very expensive, this stuff, too, right, Susan? It was like $200 per inhaler.
Per sniff.
Yeah.
Wait, per
inhaler. Oh. Each inhaler has 2 sniffs.
Right.
And it was $200, so each, it's $400 a week for the treatment, and it's twice a week for the first month. So that's.
But a lot of insurances.
$3,200. But insurance.
Medicare does.
I'll give Susan credit. She's really smart and capable, even though she's depressed, and she got insurance to cover it. Okay, so now I'll take it back. I'll take that from her. So now we're about 7 minutes into this, and Susan, we had the experience. Susan, you had the first treatment, and she reported feelings of floating, being high,
right,
burning sensation in her brain.
Yeah, it got really intense for about 40 minutes, and then after that, it starts to abate a little bit.
Yeah, like I remember I moved her from one office to the other, and she couldn't walk. After half an hour into it, she was unable to walk.
Yeah.
So you got to be really careful someone doesn't trip. And we're like 7.5 minutes into this. What do you?
Now things are getting loud. Like the fan is getting loud, which happened to me before. I
remember you telling me that.
Yeah, it's happening again.
These auditory,
like
sounds become, like you're getting high.
Well, yeah.
The external, senses become heightened.
Exactly. But I never got scared, like paranoid feeling or anything, which was my concern, which is why I brought my therapist on my first visit. I got that advice from people who have taken IV ketamine, is to have somebody go with you on your first visit if you feel nervous.
I think it was a good thing. We had 3 people around you the whole time the first time.
And now I feel...
I'm more comfortable with it. I was on edge the first time, to tell you the truth. I've never given it before. So now I know what to do.
Yeah, well, yeah.
I know her heart rate's going to go up. I know her blood pressure is going to go up a little bit. I know she's not going to be able to walk. And I know there's a 40-minute window after we give it where you're not right. I'm not trusting you to stand up.
Right.
So,
right.
We're going to keep doing this till you start feeling something.
Yeah, okay.
You seem fine now. Nothing?
No, I can feel like the little bit of sponginess in my brain in the front a little bit.
And then you said there was a burning feeling.
It was in my throat, just a little tiny bit, like salt water in your throat or something. Just from the.
The first time you did it, you were telling me you felt like you were floating.
I did get floaty, yeah.
I don't know what that would possibly. I can't relate to anything I've ever experienced like that.
It's just like you feel, the feel. Yes.
It's like
when you go over on a roller coaster, that you catch air.
Oh yeah.
You know how your head and your vagal nerve and all that woof feeling.
Yeah.
It's kind of like a subtle version of that, like woo. Not unpleasant, just heady.
Yeah. Like when you had the first treatment, you felt better. You were feeling better.
Yeah.
I mean, your mood, you were laughing and smiling, and I never see you do that literally into the first treatment. It definitely, it worked.
It did. As I said, my dad said he noticed, and other people have said to some people, on these groups that I'm getting information from, that other people may notice it before you even notice it. So
you seem different. You got more color in your face, and you just have more spunk to you. You seem more upbeat.
I think I have a little bit more
Like a
gumption.
zest in, yeah, a zest in your step.
Yeah, I
You
felt
don't
like
seem
that
like that.
yesterday, and I usually feel, I'm always exhausted. I always feel awful. I mean, 90% of the time I feel, if not bad, not good, you know. And yesterday afternoon, even though I had had a headache earlier in the day, I managed to go and get my granddaughter and do stuff. I'm not sure I would have been able to do that.
You know, I was telling Susan that I have experience with this drug in the late 80s, early 90s in New York City, and it was used in the gay community as a drug of abuse. I think they were snorting it,
Yeah. Oh,
and they called it a K-hole. I just saw people in the emergency room who had taken it.
taking too much.
Yeah. But then again, they were all drinking and doing cocaine too.
Yeah. See, now that would make it probably pretty bad. Now I'm starting to really
Feel something?
Yeah.
Tell-
It's starting to come on.
What are you feeling? So we're now exactly what is it? 11 minutes and 32 seconds into it. And you're feeling something now. What'd you feel?
It's almost, the thing I can equate it to is smoking weed. You kind of get that whoosh up your body, but it's not as edgy. It's very.
Is it relaxing?
Yeah, I was very anxious when I came in. I was super scared. Oh, super scared. I was. Upon reflection, I was.
The first time?
Yeah, the first time.
You know,
And
we were all scared the
right,
first time. We
right.
didn't know what to expect.
Exactly.
Now we know for
exactly.
sure. It hits you about 15 minutes into it. It's intense.
Yeah, I can definitely feel it coming.
Oh, it's coming on now?
Yeah. Yeah, so probably in the next few minutes it'll.
It's almost like being high, like from marijuana.
That's the
It's
closest.
different.
I mean, I haven't
It's not
done
that.
like anything psychedelic ever because of my illness. I've always been afraid that I'd be one of those people that would crack up if I did that. And that's kind of the fear that I carried in. What would that experience be like? But it wasn't negative in any way. It was woozy. I mean, I definitely, if I tried to walk now, I would probably have trouble.
So we're like 13 minutes into it, basically, and you're not standing up now. You're woozy. You're dizzy.
Yeah.
And you're feeling high.
Yeah,
Like you're floating.
Yeah, it's.
But it's nothing
Yeah, but
uncomfortable.
it's not like it's not. It's more like marijuana than alcohol. If there's a comparison, if anybody out there has tried one or the other, it's more of like I just heard the AC cycle on really well. You know, I could hear.
To the viewers, I didn't. So she's picking up things better than me.
In my particular case, now maybe somebody else's case wouldn't be the same, but it seems like my ears get really. Not like they don't ring or anything, but I can hear. You know, as I said, the fan's louder. That's louder. Everything's intensified.
You know what? I feel much more reassured because we went through this once already.
Yes.
And so, like, I just reassuring everyone out there who's viewing this that there's more to come, but it's nothing scary.
No,
just don't stand up in the first 40 minutes.
It never got. I never felt uncomfortable. Never felt uncomfortable. I felt different, and maybe out of it, but I didn't feel frightened or anxious or pain or that I was completely not in control of my body or floating up in the ceiling or anything, which I didn't know.
You seem really happy, actually.
Well, I'm encouraged. I'm really, really.
I hope this works.
I've heard so much really fantastic. For the people that
I read the literature on it, and it's impressive.
Well,
They have robust response to this treatment. and I'm very positive. That's why I'm all over it. I had to try it because it looks all good. All the research is strong.
Well, because they had the ketamine for so long. They had regular
It's
old
not
ketamine.
a new drug.
No.
Ketamine has been around since the 80s.
Now it's really. What time is it now? Just out of curiosity, how long is
We're 15 minutes and 30 seconds into
Okay.
this.
And also, we were like at 11. That
Well-
time is. Last time you said how many minutes in we were.
Yeah, now we're at 15,
Right.
30.
So I think time's a little distorted too. But
Oh.
but no,
So
because
there's
that seemed like 20 minutes to me. Not an unpleasant 20 minutes, but it seemed longer.
Yeah.
You know, I can definitely tell I'm
High.
yeah.
What are we gonna call it? I don't want to put words in your mouth.
I feel discombobulated, maybe not. You just feel a little.
Could it be an out of body experience?
Maybe that is what people think when they say.
Because you're floating,
Yeah.
and you're really not floating, but you feel you're floating. So your body and your mind are not in sync. They really aren't.
Well,
Because
no.
you're really not
yeah,
floating.
It's almost like everything. Like I can really see my hand. that kind of thing. You can. Just everything's.
You know, it's
up.
almost like acid, like a psychedelic.
It is.
More
it is
so.
It is as close as I've ever. I mean, I never did acid, as I told you, because I'm a big chicken. But it has that little bit of distortion of perception is a lot. There's a lot of distortion of like this looks like it goes down real low here right now, and I know it doesn't go down any lower.
It's almost like you're tripping. You know that?
Well, I think that
Is that? I mean, I don't know a lot about that, but
a lot of people who do the infusions say if you don't dissociate and that it won't work, and that was a concern
Yeah,
because I don't want to feel out of control.
no, that doesn't sound comfortable. That
Right.
that doesn't sound like good for anybody. That's why people came to the emergency room when that happened.
Right.
That
right.
didn't work well for anybody.
Right, and this is just really, you get to the edge of that, but I never got to a point where I felt, and I don't now, uncomfortable. It's not a negative, and that was, I guess, everybody, a negative trip or whatever people talk about.
Yeah.
And if your perception isn't being honest with you, well, could something scary, could you perceive, what if something scary happens in your perception? And, that's what I was scared of. But nothing did. And, but I'm still going up now. I mean, I can feel myself getting, or lower, or however you want to put it.
So you're still getting high, and we're 18 minutes into this, and we're still
hitting
up.
Yeah.
This whole thing probably takes 20 minutes to peak, 30 minutes, and then you start coming down. Or maybe you come up, it takes, let's say, 25 minutes to come up and 25 down, and then it's recovery after that. After 45 minutes.
Yeah, like the second half, you start to just.
Yeah, but we're still going up. And
Right.
20 minutes into
right.
this now.
But oh, yeah. I'm thinking about last time, and I can think about last time, so I'm not completely not here, but I don't know. See,
Yeah.
I can't think.
You have to
God, you don't
observe.
have a mirror in here because I would be like, to watch yourself.
Yeah,
I imagine
there's
do
a
I
requirement
see?
that you have to be in the office for 2 hours after you take it, and you
I-
definitely
yeah.
need the 2 hours. You're not going anywhere.
No.
You have to be. You have to have someone watching you. There's no way. You have to stay in the office for 2
Yeah.
hours.
Yeah, and then when I left, I went home and
You were still shaky when you left. You weren't perfect, but you weren't gonna fall down.
But I didn't fall down. I didn't feel bad. I went home. I was a little drowsy. I watched some TV, and then finally, I did fall asleep at 5.
Do you feel nauseous, or you mentioned getting a headache though?
No, I had a headache. What I said, I had a migraine
Before
I came here to get the first dose, and I had taken my migraine killer, and then the migraine came back.
Was that like an Imitrex you took? Or?
Imitrex, yeah. I take half of 100.
Did you have any other problems, like when you went home, like nausea, vomiting, trouble sleeping, eating?
But I have heard some people do get real
Restless, irritable?
yeah, some not irritable, no, in a positive way. They get
Energized.
Yeah. I just read last night, some woman had said, keep going, we encourage each other on those Facebook sites, and the one lady said she got to her 6th or 7th treatment, and when she came out of that treatment, she felt like it was a beautiful new day. It was, if you are at the level of depression that you're very low, I can see how this could bring you up.
Like you were looking forward to coming here, you weren't afraid after your first treatment. That says a lot. Because we were all really nervous.
I was afraid
the first time.
The
first time, just to let everyone know, I don't even know, I had never met anyone who'd taken this before or heard anything. We were all a little nervous.
Yeah.
But not this time, I'm like 90% less.
Yeah. I came by myself. I mean,
Yeah.
I could have.
And you're taking an Uber home?
Yeah, no, I'm not taking an Uber home.
Your father's coming? No, not your father,
yeah, my dad's caregiver. He's going to ride along. But he has to walk with a walker now. He's got to have his hip replaced. And so he's going to send her in to get me. But she's a wonderful lady. I would rather not have to have them run back and forth so much.
Yeah. So our plan is...
But no, nobody drives after this. I mean, you don't drive after
No. Our plan, so this is your second treatment, and we're going to go 3 weeks, twice a week, and then we're going to go once a week. And I'm really confident. I think you're doing better already.
I trust my dad to tell me the truth. And this, actually, I got to tell you, I feel this one feels better.
You're not as high as you were the first time. There's something different about this one. You're not as dramatically high or impaired. The first time you did it, you were definitely more...
Well, I had so much pent-up anxiety.
Yeah, okay.
And, because
is it hitting you as hard the second time? Or you think it's about the same?
I think
but you're just more nervous the first time?
No, I think it is. I think when did we come in here?
20 minutes into it.
Yeah. See, is that about where we are now?
Yeah, we're 25 minutes into it.
Yeah. So I went up a little. So I'm probably still gonna
go up.
Yeah.
No, I agree. Yeah, I would say somewhere 30, 35 minutes. I'm going to continue this video until you peak.
Oh, geez, you made me standing there a while.
We're, so 25, maybe 10 more minutes.
Yeah, actually. It wasn't.
You're holding it together well.
Now, some people would say that you're supposed to, this is something I've read, and I don't know if this, the hardcore ketamine people say that when you dissociate.
You've met someone online who's used it, like, not Spravato.
IV ketamine.
Yeah, is that from the street?
No. This is people who
have had it
for
anesthesia.
No, for depression or pain.
So
there's a site. It was really small. They've exploded since Spravato.
You can get IV ketamine,
and you go in but everybody says, oh, you have to, float out into outer space, or it's no good, and you'll get a better response. And of course, me being me, I was like, well,
that doesn't sound fun.
Is it that the people who float into outer space, is that the chicken or the egg? Is it that people who tend to float out there are the people who get a better response, or is it that you can learn to float out there and meditate and, you know, try to transcend the experience, and supposedly the more you know, that gives you, especially for people with trauma, somehow if you have PTSD,
You dissociate more.
if you dissociate more, it lets you see things more clearly, it helps you heal, but you have to have somebody with you to help you process what you come across while you're so busy out there.
There's some psychedelics out there like acid, lysergic acid, psilocybin.
Yeah.
Then there's ibogaine, which is that West African type of psychedelic. Then there's what's the one, the death hormone that they use in religious services?
Oh, you mean the one that makes zombies?
Oh no, that's bath salts.
No. I don't mean bath salts. I mean the one like in Louisiana that they used down there. I say Louisiana. I'm
New Orleans.
referencing
Voodoo stuff.
Yeah, voodoo stuff. There's a drug that they use.
I know. It's on the tip of my tongue. I can't remember it. What is it? And I can't use my phone to look it up because I'm using the phone to record you. And I have to stand here and hold it. What was it? I forget. I know someone who did it.
Oh, really?
But some kind of religious service.
Right. It's like.
I don't think it's illegal. It's and it makes you vomit. They call it the vomiting.
Ooh.
Yeah, everyone vomits. It doesn't sound pleasant. It's what your body releases when you die. Ashwagandha, no. Something like that. Not ashwagandha. Something like that. I forget. We're stalling it until she peaks anyway. To the viewers out there. But I think everyone needs to see this to know, to desensitize people to the fact that nothing's terrible's happening.
Right.
Is put everyone at ease. So that's why I want it out there.
And that's why, to be honest, it would have been really helpful to me
if you had seen this before.
Because I was scared. You know.
Right. Once these videos get out and people see, okay, but it's something going on. You get high, you feel like you're floating, your senses change, you get a little burning in your throat, and you definitely are dizzy and unstable on your feet.
Yeah, I
and
can
it's
walk.
a 40-minute roughly period where you get higher and higher, and your senses start hearing things and feeling things differently, more acutely, more intensely.
Yeah.
But you've kept a conversation with me the whole time. You're better this time.
I talked with Vincent, and I talked poor Emma's ear off at the end.
I'm going to bring her back in. She's my student.
Oh.
If you look at my other lectures, I'm saying to the viewers, Emma's the student. She's going to talk with her.
Oh.
I'll maybe make her...
She's very kind-hearted, nice person.
Now she's going to see the video. We're talking behind her back.
Now you know what
people
really say about you behind your back.
As part of her course, she's going to have to watch this. So, but I think it was good for her to see what it would be like. I think everyone was really curious.
I was already coming down.
I talked to a pharmacist yesterday. He says, I thought we were the first ones to get it in the state, but he said, oh no. He's sold like 12 or 13 treatments already.
Really?
Yeah, we bought 2 of them, but...
Well, I'll tell you, people are squawking for it. People want to try it. I mean, people at least that I'm dealing with on this.
You know what? I'd rather do this than that TMS, transcranial magnetic stimulation. You know, that, where they do the magnetic.
You know,
and the ECT. You went through electroconvulsive therapy. I mean, and you have memory problems from that still.
Yes.
You had to do it because that was all that was available then.
Yeah.
But I'm not a fan.
This is much less traumatizing than that.
The ECT, you got to go to the hospital. You get put under anesthesia.
Awful.
They shock your brain. You get a seizure, and you're gonna have permanent thought problems, memory problems. I don't know. We're talking
believe
about
me, if they had
this then.
Yeah,
You did the transcranial electrical stimulation. That helped.
You know what that really helped with was, and I was telling Emma.
It's called TES, yeah.
TES.
That machine over there. See that machine to the viewers? That worked.
Yeah.
So
and it did.
And it wasn't traumatic. It's a helpful thing, but it just...
It was good for my evening anxiety. I stopped after the first time I did it, you know, the 10 treatments or whatever. Is it 10 that you do?
10.
10.
I upgraded 5 years later to 15 now. And
Really?
I put in the light therapy.
Oh. Well, the thing I noticed is that my craving for alcohol went away.
See, that machine does increase
It does
dopamine
something.
in the cerebral spinal fluid. And dopamine is the neurotransmitter for the reward system. And that's what alcohol, nicotine, heroin, opiates, OxyContin,
Really?
they do. They release that dopamine. And that's what everyone's looking for. So does sugar, by the way.
You don't have to tell me that.
Yeah, dark chocolate's good for you. But the sugar in the dark chocolate's no good.
Yeah,
So-
I'm a big eater. You know, I was always like, how come I can't be one of those people that can't eat when they get depressed?
Yeah. So, how do you feel now? We are 31 minutes.
I think I'm.
Peaked.
I think so. I think that I am.
So we're 31 minutes into this. It's exactly what we thought. And the whole thing, I mean, we're at the peak point, I would say, right now.
I think so. I mean, I'm definitely. I will be interested in seeing this because I have no idea. I feel very different.
So when I put it on the YouTube channel,
Yeah.
Mark Agresti, M.D, comment on it. And let's
Okay.
start a conversation because
Yeah.
I'm probably going to run this video 30 minutes and will be a 35-minute total that you're into it. And that's exactly what we think. You're peaked.
Yep.
But we don't know how long the peak lasts. Not that long. 10, 15 minutes?
No. Yeah, it's not. It's gonna rain.
It's going to rain and it's really hot out. It's June 19th, Florida. I was running on the beach today and it was so hot. We have a moment of silence here.
Moment of silence.
It's unusual with me because I talk a lot.
Bring water. Thirsty. My lips feel dry, but we'll wait.
We'll finish this. I'll get
Yeah,
water
we'll
in.
finish. That's fine. That's fine. But
I actually have dry mouth too. I think it's from the talking. How often do you talk for half an hour straight like this under a video? That's what's doing it too, because I have dry
Yeah.
mouth. Or maybe I'm just nervous.
well, why are you nervous? You didn't put chemicals in your brain.
But I'm nervous for you. It's secondary anxiety.
Right, right.
I'm not that bad. I feel like a million times better than the first time.
Yeah.
That was not comfortable. Because, you know, I'd seen some videos on it, read a bunch, but that's all intellectual. When you're down and dirty, when you have someone in front of you. There was some elevation in heart rate, and there was serious elevation in blood pressure, so there is a spike in blood pressure. I did the blood pressure, and it was high. I mean, you were like, let me just check the chart, but it was high.
Yeah, it was high.
It was-
But I do have that tendency for my heart to go fast and my
yeah, that was from the ECT caused damage to the
Yeah.
heart, right?
Yep. And they told me I had the worst side effects of anyone they had ever seen.
Yeah, the blood pressure went from like 119 over 80 to 149 over 97 with a pulse of 97.
Yeah, that
So-
pulse 97 is nothing for me.
Yeah, so she's got a rapid heart rate, but
Yeah.
yeah. So the blood pressure did go up, but it was temporary because when I repeated it, it started going down, way down. It was up for, I'm guessing, at least an hour. We're there. I mean, I don't think anything different's going to happen at this point. We've peaked, and
Yep.
it's only we're there. We'll stay at this peak last time wasn't even but 5 to 10 minutes, and then
Yeah, I don't know when various people came in, but I know that Vincent was gone for a while, and I talked Emma's ear right off.
I'm probably going to go get Emma. We're 35 minutes into this, and I think we've reached what's going to happen. It was pretty anticlimactic, but stuff does happen. We're more prepared this time, so I advise people watching this video, so you know.
Yeah.
I mean, there's a burning sensation in your throat. It hits you in about 5 minutes. You start hearing things better, feeling things better. You start feeling like you're floating. You get high. Your sense of reality is distorted. You have a time distortion. And you started getting happier?
It's not uncomfortable. It's not, I mean, I wouldn't want to go around and feel like this all the time because you couldn't function. But
there's dizziness occurred.
Yeah. And I definitely couldn't get up and walk right now.
No, there's no walking. That's why I put her on this couch, and she's not going anywhere. I'm going to go get her water now. So we're now 37 minutes into it, and I think that's all she wrote.
Well, then my estimate was pretty close, 40 minutes, and then...
Yeah.
Yeah. Which is surprising considering the distortion of time. But Vincent was keeping close notes, too.
Yeah, so now we're 37.
Wow, I can't believe all that time's gone by now. First it's long, and then it's short.
This
So
is what we're talking.
it definitely distorts time.
Yeah. All right, I'm going to shut this off now. I feel pretty comfortable that I'm going to go get her water. I'm pretty comfortable that she's doing okay.